So I was waiting on a stat like this to come out because I figured that this would be the case because of COVID-19 and the isolation, that was, I guess, necessary, to be able to fight back against the virus. Um, and I figured it would lead to something like this. So here's from the New York Times. Overdose deaths have surged during the pandemic, CDC data shows. This is from Abby Goodnow. More than 87,000 Americans died of drug overdoses over the 12-month period that ended in September, according to preliminary federal data, eclipsing the toll from any year since the opioid epidemic began in the 1990s. The surge represents an increasingly urgent public health crisis, one that has drawn less attention and fewer resources while the nation has battled the coronavirus pandemic. So the reason that she's claiming that this happened was because many treatment programs closed during that time, at least temporarily, and drop-in centers that provide support, clean syringes, and naloxone, the life-saving medication that reverses overdoses, cut back services that in many cases have yet to be fully restored. The preliminary data released Wednesday by the Centers for Disease Control and Prevention showed a 29% rise in overdose deaths from October 2019 through September 2020, the most recent data available compared with the previous 12-month period. Illicitly manufactured fentanyl and other synthetic opioids were the primary drivers, although many fatal overdoses have also involved stimulant drugs, particularly methamphetamine. And unlike in the earlier years of the opioid epidemic, when deaths were larger among white Americans in rural and suburban areas, the current crisis is affecting Black Americans disproportionately. The highest increase in mortality from opioids, predominantly driven by fentanyl, is now among Black Americans. Dr. Nora Vocal, the director of the National Institute on Drug Abuse, said at a national addiction conference last week. And when you look at mortality from methamphetamine, it's chilling to realize that the risk of dying from meth overdose is 12-fold higher among American Indians and Alaskan Natives than other groups. So dealers are lacing these non-opioid drugs with cheaper yet potent opioids to make a larger profit. Someone who addicted to a stimulant drug like coke or meth is not tolerant to opioids, which means they are going to be at a high risk of overdose if they get a stimulant drug that's laced with an opioid like fentanyl. Okay, so the biggest issue right now is a lot of these dealers that are dealing to these people are lacing what's in, what are lacing the drug that they're giving to, the people that are the drug user. They're lacing it with something that's cheaper so they can make a larger profit. And a lot of time that, what it's laced with is something like fentanyl or these stimulant drugs, that go and counteract with the other drugs that people have been taking. So obviously this is not a uniquely American problem, but it is a problem that is, it is so bad to the extent that it is unique to America how bad of a problem this is, right? And a lot of people, experts, and I've heard it mostly from Chris Hedges, say these are deaths of despair, and that's why it was really big in rural America. I remember in West Virginia, there was one West Virginia pharmacy that had the most orders for some of these opioids, and had some of the most overdoses and the worst rates of overdose in the country, in these small, poor West Virginia towns. So they're what we call deaths of despair. And, people who don't have a lot of job prospects, don't have a lot of opportunity, don't see a very, high ceiling, high potential for their lives, then, they begin self-medicating, because in this country, we don't provide free mental health service like in a lot of other countries. A cheap way for someone to self-medicate is to just start trying drugs, right? Which give you this euphoric feeling temporarily, but then you're hooked on it, and it consumes your whole life, right? We saw that with the crack cocaine epidemic in the 80s. We've seen it with the opioid epidemic since the 90s, and of course, these drug companies don't care about that. They'll keep pushing this stuff out. They'll keep giving you 30 to 40, opioid pills for a small thing that you probably don't even need opioid pills in the first place. You could probably just take something more holistic or much less potent. So that's the issue in this country that we're having with opioids. It's gotten worse, because people have felt more isolated. People have felt more depressed. People, a lot of people are losing, at risk of losing their homes. These people are having to decide between rent and food. And you can't imagine the amount of stress and anxiety that puts on a person's life, particularly when they have a family, right? And that's what we say. These are deaths of despair. And so it's gone up a lot more because of the pandemic, and Black Americans have started to be disproportionately more affected by this stuff. So, what are the solutions? Well, the solutions are you need to legalize and regulate the drug. And you need to actually treat it, like people have been saying for decades, as a public health issue and not a criminal issue. So, what is it doing? What is it doing to criminalize these behaviors? We've tried that for 30, 40 years, and it's only made it worse because you're not actually attacking the conditions that made people, make the decision to go out and try a drug and get that temporary euphoric feeling because of the despair that they're in or the opportunities that they don't see for their own future. You're not actually attacking the core root cause of the issue. You're not providing jobs. You're not providing people health care. You're not making sure people can pay their rent. You're not making sure people can pay for their food. You're putting people, you're backing people into a corner where they have to decide and conceptualize, am I going to be able to survive next week, next month? So you have to attack the root cause of these issues. But of course, the people in government never do that. What do? They throw more money to cops. They throw more money to actually criminalizing the issue, which we've seen since Nixon has not made this issue better. In fact, last year, as we just read in that article, we had the most overdose deaths since the beginning of the 90s. So all that money, the crime bill that Joe Biden pushed through and advocated for I think almost a decade before he was, the final author of the 94 crime bill. Bill Clinton passed it under a Democratic administration, skyrocketed the prison population, mostly Black and brown people, taking the main breadwinner away from a lot of families, taking fathers away from a lot of children, right? So we understand. So with all that, and you have somewhere like LA where 50% of the discretionary spending budget goes to the cops, right? So that has been set into motion really since the 90s. And what has that done? Nothing, because we have the most drug overdose deaths since the 90s last year. And so everyone who pays attention to this issue understands and actually advocates and fights for the working person, for the normal person who doesn't look at drug addicts as some, other subhuman being, but actually looks at them as brothers, as sisters, right? As kids, as fathers, as husbands, as wives, right? When you look at it like that and you understand that a lot of people have in their own family someone who they know are conflicted by that disease of addiction. We understand and they understand that you have to attack this as a public health issue. So the answer is to legalize and regulate the drugs, because then you're already going to be taking away, those deaths that are from when those drugs are laced with things like fentanyl and methamphetamine, so that drug dealer can get a bigger profit. You take that away, right? You undercut their market. You take away their market, because if someone can even, they're afflicted with this disease. Do I want them to be afflicted with this disease of addiction? No. That's why I'm going to advocate for them to get the mental health help free of charge, paid for through a mental health care system that's actually sane, right? Rational, logical, and up to date, up to the 21st century. That's what I'm going to advocate for on the back end, to make sure that they can stop using those drugs. But in the moment, if they're going to get that drug, no matter what they try, they're going to get the drug. You've already tried to make it, criminalize it so they're not going to get the drug. That didn't work. You tried it for 30, 40 years. It didn't work. It only exacerbated the problem, made it worse. So if they're going to get that drug, let's make sure that drug that they're going to get is not laced with fentanyl or methamphetamine. And in the meantime, let's work on their mental health so they can get off this addiction, get away from this addiction, and actually, return to life and return to society, as a productive member of society, right? So that we know, that we understand, has been researched. That's the, solution to the issue. What are we getting from Biden though? You know, who, like I said, was the author of 94 crime bill. You know, recently was in the news because he's firing staffers for past legal recreational marijuana use. In 2021, he was firing people for that. Unbelievable. I mean, it's not unbelievable. It is believable considering who Joe Biden is, who Joe Biden was, what Joe Biden has fought for his whole career. So what is he going to do about this issue that's popping up? Well, Biden looks to extend Trump's bolstered mandatory minimum drug sentencing. Biden administration expects to announce support this week for temporary extension of a Trump-era policy expanding mandatory minimum sentencing to cover a range of fentanyl-related substances. More than 100 civil rights, public health, and criminal justice advocacy groups sent a letter last week urging Congress and President Joe Biden to oppose any extension of the Trump policy. They were ignored because he doesn't, he'll claim when he needs your vote that he cares about criminal justice, and he wants criminal justice reform, and he wants to treat some of these issues like the one his son had and has, or I don't know if he still has, but definitely had. We're going to treat it as a public health issue, aka they need to go to rehab. They don't need to go to jail, right? That's what he says about it. That's what he said about his son. That's not what he was saying in the 90s about all those black and brown people he wanted to lock up. He didn't say that. So that's what he's saying now. But then, after he got your vote and now that he's in power, what is he going to do? He's actually going to extend. He's making the active choice to extend a Trump era policy. Right. And so, they can't extend the policy without congressional action, which is expected, but they are expected to support during a Wednesday hearing on substance use before the House and Energy Commerce Committee. So once again, here's crime bill Joe Biden. Just once again, not attacking the root cause of the issue. He's just going to criminalize it further with these mandatory minimum sentences, which before he said he was going to get rid of. He actually put it on his campaign website before the election. He said he was going to get rid of that and fight to get rid of that, but he's doing the exact opposite when he's in power. So this issue is not going to be resolved. It's just going to be exacerbated and made worse by continuing to criminalize the action, criminalize the dealer instead of actually just undercutting the dealer, legalizing and regulating it, and then putting a lot of resources into mental health help so that these people can, become unafflicted by this disease of addiction. So that's how we need to attack this issue. That's how we need to attack it. Joe Biden's not going to do that. He's not going to listen to the civil rights advocacy groups. He's not going to actually put in, real, true criminal justice reform in this sense. He's not going to deschedule marijuana. He's not going to release and, expunge the records of all nonviolent marijuana and drug users. He's not going to do any of that. Why? Because in his heart of hearts, Joe Biden has always been for criminalizing this, putting more money towards police, which he said he was going to do during the campaign, and not actually addressing the root cause of these issues.